3 News Now this week.
Dozens of protesters gathered in the Midtown area. They tell me that the fight for justice locally and across the country must continue until they begin to see a real change. Now, the group Pro-Black is the one who led the event today. It started at Turner Boulevard and Farnham Street. Organizers say they wanted to shine a light on the city's own racial injustices, such as the murder of James Scurlock. He's the 22-year-old black man who was shot and killed by Jacob Gardner, a white bar owner, during the height of the protests back in May. Now, the group says they're also there standing in solidarity with protesters in Portland who have been fighting for social justice and racial equity for more than 50 days. Now, attendees say people must come together to fight corrupt and oppressive systems.
For the city of Omaha, it's important to seek justice for James Scurlock. We have not seen any justice for him and his family, for his daughter, who deserves to grow up with a father. And Don Klein, frankly, just hasn't done his job for the city of Omaha.
If the same thing had happened with a white kid who tried to stop a black man from firing a gun and got shot to death in the same manner, I guarantee you it would have been longer than 36 hours of deliberation by the city attorney.
And John, we also heard from an organizer, Bear Alexander. He says more people in his generation need to step up and demand change.
Our political leaders haven't had the pressure by the citizens. Like the political leaders have been coasting fine. Nobody has been putting that pressure on it. They have been living the best life for a political leader. No protests, no sit-ins, nothing like that. And so now is the time to put that pressure on them.
And Alexander tells me that he plans to visit Portland tomorrow in support of the cause. Now, John, in speaking with protesters, some of those protesters told me that the best way to see a change is by voting so that your voices can be heard. We'll keep you updated on more information about protests as they come in. Reporting live from the newsroom, Sydney Gray, 3 News Now.
Cutting and delivering flowers is what Purple Orchid Flowers in Bellevue is all about. They're used to Mother's Day and Valentine's Day specials, but now a pandemic special.
Well, this one's definitely been the powerhouse.
Owner Rachel Sajan says they ordered $10,000 in fresh flowers to sell at Omaha Public School graduations starting this week outside the Baxter Arena. On Monday, OPS announced summer activities and 2020 graduations were canceled.
I literally called my husband and said our worst nightmare has happened.
Rachel went to Facebook to let people know she had flowers she still needed to sell to recoup her costs. It's been shared almost 2,000 times.
Very blessed. One of my favorite all-time movies, even though it's a Christmas movie, is It's a Wonderful Life. Trying not to be emotional, but just, at the end of that movie, everybody comes in and chips in and helps them out.
Gina Ham saw the Facebook post and had to come in to help her daughter's friend.
It's a little upsetting that the small business owners are the ones that are taking the brunt of this, and so this was just a little something we could do.
Rachel says this is only about half the shipment. The other half comes in on Wednesday.
Other florists are also stepping up. Karen Weiss says she could get flowers ready for people to purchase for this small shop that mostly does deliveries.
I did think it was really important. I know that if I was in the same situation, I would definitely want some of my friends in the industry to reach out and see what they could do to help, and I would take it.
A diverse array of people coming together to make something shine in a tough situation. Reporting in Bellevue, Jake Wazakowski, 3 News Now.
You want to pull up the straps?
Even though each school district's plan for reopening is fluid, one thing seems pretty common across the board.
We are requiring masks for all students and staff and anyone that enters the building or comes onto school property.
They'll be required at Papillion La Vista schools, as spokesperson Annette Iment explains why.
The health experts throughout the country and also in the state of Nebraska, all of them were recommending that kids wear masks in schools.
And most major school districts are requiring masks, including Papillion La Vista, OPS, Millard, Westside, Ralston, and Bellevue.
We just
put them on our face and then around our ears.
Christine 8 Masood's 2 boys will be attending Two Springs Elementary in Bellevue. She knows masks are required for students and wanted to make a few that her kids would like.
Yeah, I've made some masks that I'm pretty comfortable with and the kids are comfortable with wearing as well.
Children's pediatrician and head of the Nebraska chapter of the American Academy of Pediatrics, Dr. Melissa St. Germain, says every parent should be buying masks or making masks right now and prepping their children to get used to how they feel.
We ask kids to do a lot of things that they don't want to do at first. We ask them to wear seatbelts and brush their teeth and put on shoes. 2-year-olds don't always like to do that either, but with practice and repeated reinforcement, they generally do pretty well.
Most children will be okay breathing in the masks. The material is thin enough where it shouldn't be a problem for everyday wear for kids over the age of 2.
It may feel like it's harder to take air in and out, but oxygen and carbon dioxide are going through that mask just fine.
And the tiny droplets that spread COVID-19 are not going through the mask, which is why they are so helpful when it comes to preventing spread.
The virus particles are small enough to fit through a mask, but viruses don't travel through the air like that most of the time. They travel on droplets, and the droplets can't fit through the mask.
For those hard of hearing, a clear mask or face shield are recommended. Papillion and La Vista schools have already ordered a batch for all teachers and some students who may need them.
We're putting plans in place to accommodate all students.
Most school districts have stated that there will be mask breaks and there are exceptions to who has to wear them. But most students do and may face some sort of disciplinary action if they don't.
So a student that refuses to wear a mask, it would be treated under our disciplinary code just like any other school rule violation would be treated.
Each district is making the decision that they best see fit for them, and most are lenient given to how quickly things change with the virus. But now is a great time to start buying masks, practicing wearing them, and explaining to your children why they're important.
I know parents are anxious about sending their kids back to school, and there are a lot of questions, but if you reinforce to your child that it's going to be okay, there's going to be changes, and they're important and they're necessary, and we're going to get through this, that goes a long way.
Iowa Governor Kim Reynolds gave guidance today for schools as districts finalize plans to return to school. Reynolds maintained students need to be back in the classroom. She said positivity rates are key to making decisions about in-person learning versus remote. Anything less than a 15% positivity rate in a county over 14 days means students should stay in school. From 15% to 20% with a 10% absentee rate among students, hybrid learning will be called for, she said. In a situation where there's substantial uncontrolled spread, greater than 20% positivity, online learning will take place. Reynolds stressed that state agencies, school districts, and county health departments will need to be flexible. We have a poll on our website, 3newsnow.com, asking you what you think about Iowa's guidelines for returning to school.
A mask mandate appears to be coming to the city of Omaha, with exact details coming out later this week. The meeting sparked fierce debate on whether the mandate is the right thing for the city of Omaha. Dr. Adipour told the board a mandate is needed due to rising case numbers, hospitalizations, and positivity rate. But many who attended the meeting say a mandate goes against individual freedom.
I believe in personal agency. I believe in our right to make a adult decision based on data.
I can't believe this, that we're going to go to these draconian measures of mandate, of taking away our freedom.
But Poor says this is different, as not wearing a mask hurts others.
As long as you only affect your health, it is your choice, but the moment you affect others, it is really a choice for the entire community that we need to keep safe.
Some believe masks hurt your breathing. Others say people simply need to develop immunity to the virus.
Obesity is the epidemic. A weak immune system is the epidemic. And the conversation is not supporting what will actually help the people of Douglas County.
Board Chair Chris Rogers later rebuked that argument, saying we can't develop our immunity to the virus until a vaccine comes.
You have a vaccine for the flu. That's fact. That's science. You have a vaccine for the flu. You don't have a vaccine for this.
Others spoke up for a mandate, including Jacqueline Fernandez, an Omaha nurse.
I've been working at the hospital for 4 years, and I've never seen us so busy, so understaffed, and just not having the resources that we need to take care of these patients.
Another man that spoke up said wearing a mask isn't that hard, and it's just common sense.
That's all we're talking about here. We're saying put on a mask to help protect your fellow citizen. That's it. That's it. When we sneeze, when we cough, do we teach our little kids to cover their mouths, or do we just say spray it everywhere? What do we say? Okay, we say cover your mouth. That's all we're asking.
In Omaha, John Kipper, 3 News Now.
Just after 7:30 Thursday morning, police found 2 people shot and killed in the parking lot of the Best Western Hotel near 108th and L. Police identified them as 36-year-old Nicole Hatton and 35-year-old Michael Harbour. So far, no word on any suspects.
A study of evictions in Douglas County shows us the dark history within Omaha, racial injustice, segregation, heavily impacting Black and Hispanic communities.
Unfortunately, that's not shocking. I think just based on, what we know about how persistent racial segregation is, not just in Omaha, but in other cities around the country.
Pierce Greenberg is the researcher with Creighton University. He, along with a team, looked at over 39,000 eviction cases between 2012 and 2019. They found the majority, more than 28,000, ended in eviction.
I mean, when you look at the map, it's more or less where our communities of color are in our town.
The study has maps showing high-impact areas, demonstrating a racial divide, showing high evictions in places like North Omaha. The Urban Institute data shows Omaha ranks 271st out of 274 U.S. cities on a measure of racial inclusion. The authors found 7% of those evictions are within the Housing Authority, and the authors, like Gary Fisher, who used to work for the Family Housing Advisory Services, says city officials need to take a closer look on what should be done to fix this.
People are asking questions, and I think it'll lead to, our goal is that it will lead to further discussion, and that this will stimulate some other thinking and some other ideas about other questions that we could be looking at.
They also brought their findings to city leaders, giving them a chance to assess what kind of changes can be made, right the wrongs of past practices that led to segregation and poverty.
It's not just an individual issue of individuals that, get evicted, but that this can be a neighborhood issue, right? It can impact communities in different ways, and that there are inequalities across Omaha, obviously.
The authors plan to do more with this study, interactive maps that can literally pinpoint a hotspot right down to a particular home or apartment complex. Jeff Van Sant, 3 News Now.
So more than anything, it's just to start a conversation on it.
The Douglas County Republican Party wants a public debate on hydroxychloroquine. That's why they sent out this tweet Tuesday.
Just saying, if there are now studies that are coming out that are showing that it could show some promise, that there is definitely benefits to hydroxychloroquine. Obviously, we wouldn't tell people to take any sort of drug without consulting their physician, so we're not promoting it.
The majority of the medical community disagrees. On Wednesday, Dr. Anthony Fauci, a member of the coronavirus task force, told MSNBC that every valid clinical trial shows consistently that hydroxychloroquine is not effective in treatment of coronavirus disease. Local experts agree. Dr. Mark Rupp, chief of the Division of Infectious Diseases at UNMC, says doctors should not prescribe the drug.
Although their heart, it may be in the right place where they're trying to help people, I think the data suggests that they actually may be harming folks. To just go out on a whim and a hope is not in the best interest of patients.
That wasn't the only tweet the Douglas County GOP pushed out Tuesday. They also retweeted a link to a video of doctors that disagree with Fauci and local experts. The video was quickly pulled from Facebook, YouTube, and Twitter due to misinformation. One of the doctors that spoke is particularly controversial.
You don't need mask. There is a cure.
Again, I didn't necessarily watch the entire press conference. I'm not pushing for what they're saying. I'm just saying that clearly studies have shown there's something to look at there.
Dr. Stella Emanuel, who spoke at the presser, tweeted Wednesday that people needed deliverance from demon sperm.
We can all agree that, all right, that's completely weird and wrong.
Dr. Rupp says people need to rely on trusted sources for information, and the press conference with the doctors, while he hasn't seen it, is disconcerting.
I think this is, unfortunately, a disservice to the public, to patients, This is something that is very dangerous.
In Omaha, John Kipper, 3 News Now.
This letter, called Coronavirus 2 Letter for Midsummer, allegedly came from Family Medicine at Legacy in West Omaha, and according to health experts, it's filled with a lot of outright lies, even dangerous information. Take this one related to treating COVID patients. We have a 100% success rate with hydroxychloroquine, zinc, and sometimes Z-Pak and steroids.
I don't think there is any evidence that supports that is the way to treat COVID.
Dr. Ann O'Keefe is with the Douglas County Health Department. She saw this letter just a few days ago, and it's raising concerns in the medical field here in Omaha.
I initially got a copy of it from a physician at Nebraska Medicine who was concerned about it.
3 News Now investigators reached out to DHHS, and it's aware of the letter and says, in general, if there's an issue with a business, facility, or provider, we will review, investigate, and work to remedy the situation based on our findings. We found dozens of reviews related to family medicine. Most center around this letter, some for it, most against.
You know, it's irresponsible and dangerous to put out information like that, and especially if it's coming from a source that has, credentials.
Thank you for holding. This is Elise. How can I help you?
We reached out to Family Medicine at Legacy twice for comment, who wouldn't confirm nor deny the letter came from them.
I can take your name and phone number and give it to our office manager, Marie.
The letter says there's a zilch, zero, nada evidence that masks protect people from the virus. That, too, is a lie.
So this is an easy intervention, and we know that we can reduce transmission, and this is a really key time right now.
We will continue to follow this story for any update, or if the practice will respond, or what might happen with DHHS. Jeff Van Sant, 3 News Now.
People will not be required to wear masks inside public places and when social distancing can't be followed. Douglas County Health Director Adi Poor and Mayor Gene Stothert, along with 5 health experts, plea to the public to wear face coverings, though it won't be mandated.
But we can do this. We can do this without a mandate, and hopefully the information you receive today is going to lead everyone in that direction.
The city law department felt they could move forward with it, but the Nebraska Attorney General's office felt state law trumps city code. The mayor says passing a city ordinance could take months.
But we don't have time for a court battle. Like we said earlier, we should have been wearing masks, everybody, weeks and weeks ago. So we need action right now.
I'm frustrated that as a community we could not find a way to surmount perceived political threats, potential legal challenges, or logistical hurdles to mandate mask usage in our locality.
The county says they've seen infection rates increase for white people from 17 to 31%. Also, Children's has seen an increase of kids with acute COVID infections over the last 2 weeks.
And while children, for the most part, tolerate this virus very, very well, they're either asymptomatic or have mild symptoms, there are those children that get sick and who require admission to the hospital.
Mayor Stothert and Dr. Poor say it will be difficult, but hope communicating the importance of masks over and over will change behaviors.
I've heard a lot about liberty over the last few days, but liberty also requires responsibility, and that is what I hope everybody takes into account.
This is not a political issue. This is a health and safety issue.
Dr. Poor and Mayor Stothert said that they could revisit the mask mandate in the future, but they said it's unclear as to a number or if there is a specific infection rate they would have to hit before doing that. Reporting near 42nd and Center, Jake Wazakowski, 3 News Now. 52-year-old Lori Torgerson says much of her summer off from school has been a blur. The Underwood Elementary librarian says she contracted COVID around Memorial Day, which she managed until it hit.
I was sick for 13 days before I actually sought medical help.
Torgerson was rushed to the CHI Mercy Hospital in Council Bluffs. She couldn't breathe and was put on a ventilator.
I knew then I was bad, and I knew I was scared then.
Later, she was put in a medically induced coma for 3 weeks before coming out and improving. Friends and medical professionals call her a walking miracle.
It has been a hard road, but for me, I'm one of the lucky ones, and they keep saying I'm a walking miracle, but I wasn't going to let COVID win. I have other reasons to still be alive.
Torgerson got plasma and remdesivir infusions. CHI Mercy says they've had success sending most COVID patients home alive.
We can't determine necessarily who is going to get super sick super fast. It can affect different age groups.
Lori's seen a lot of support from friends, family, and her nurses, cheering her on at her darkest times and during her recovery. She wants to thank everyone for their love and support and continue on the road to recovery after being so close to losing her life.
It still makes me cry, sorry. You don't realize what an impact you make on people, but I would not have expected them to step up because I'm not usually the one that's in need of something. I'm usually the giver.
Even though she's COVID-free, Torgerson says that she's still pretty weak, so she's going to occupational and physical therapy to make sure she can regain her strength and be able to push those carts of books to students throughout Underwood Elementary. Reporting in Council Bluffs, Jake Wasikowski, 3 News Now.
Stay connected at 3newsnow.com.